Good day. So for today, we're going to discuss about the functional training called sit to stand. So this sit to stand is important for patients with stroke, with low back pain, and with cerebral palsy. So what is stroke? A stroke may be caused by a blocked artery or the leaking and bursting of the blood vessel. It can be in the brain, in the heart, or whatever vessel in the body.
So the following are the effects of stroke on the patient. The patient can have breathing and heart functional impairments, body temperature control impairments as well, and balance and coordination also, which can be seen in the weakness or paralysis they can incur.
Now we go to back pain. The causes of back pain are: first, muscle or ligament strain; second, bulging or ruptured discs. It could be also caused by arthritis; and skeletal irregularities.
Complications of low back pain mainly causes limitation to movement. Furthermore, gaining weight can cause limitation to instrumental daily activities such as walking, sitting, and standing. For cerebral palsy refers to a group of disorders that affect muscle movement and coordination. In many cases, vision, hearing, and sensation are also affected. For cerebral palsy, it is most common in children. Cerebral palsy refers to a group of disorders that affect muscle movement and coordination. In many cases, vision, hearing, and sensation are also affected. So what are the causes of cerebral palsy? Usually this happens before birth, but it can also happen during birth or the first years of life, due to the abnormal brain development during pregnancy.
For the test itself, with the 5-time sit-to-stand test, it assesses functional lower extremity strength, transitional movements, balance, and fall risk. For the equipments of this test, we should have a stopwatch, a standard height chair with straight back, probably 16 inches high. And for the interpretation of these tests, of this score, lower times equates to better scores, and according to MDC, 3.6 to 4.2 seconds is normal, and according to MCID, 2.3 seconds is normal as well. And there's a age bracket for each scores. For 60 to 69 years old, 11.4 seconds, 7 to 79 years old, 12.6 seconds, and 80 to 89 years old, 14.8 seconds. And there are precautions in doing this test, especially for geriatric patients. It needs for further assessment of fall risk, probably not over 12 seconds, and recurrent falls over 15 seconds. And for vestibular disorders, the fall risk is over 15 seconds, and for Parkinson's disease patients, fall risk is over 16 seconds.
Today, we're going to do the sit-to-stand test to assess functional lower extremity strength, balance, and fall risk. So today, I'm going to demonstrate with Raj Bardolido, right over here. So today, first, sit in the middle of the chair with your feet flat on the floor and your arms across your chest. Next, you're going to do 5 times as quickly as you can, and I will time you at the 5th repetition. Okay? So, I will time you. Ready? Set, go. 1, 2, 3, 4, good. Last one, 5. Okay, good. Today, we're going to do the sit-to-stand test to assess his lower extremity functionality, balance, and coordination. For safety precautions, we're going to use a guard belt for special cases like stroke patients and with Parkinson's disease. So, we're going to start. So, I'll be placing a guard belt to the patient. Then basically, I'm going to provide assistance for this case since he has Parkinson's disease. So we're going to do 5 repetitions of sit to stand with you, and I will be assisting you throughout the whole session. Okay? Ready? 1. 2, 3, sir. 4. Okay, good. Last one, sir. 5.